Getting rid of acne in most cases can be one of the most effective Luxmaxes. Contrary to popular belief, acne is not as easy as just changing your diet. It is caused by inflammation from blocked hair follicles that occur when excess oil, sebum, dead skin cells, and bacteria build up on the skin. This could be caused by diet, but also by other mechanisms like hormones. Because of this, compounds like Accutane have gained great popularity. This video will reveal if it is some overhyped scam drug or a staple that everyone should use. History. Isotretinoin was originally studied and patented in 1969 by Roche Laboratories as a possible treatment for skin cancer. Isotretinoin, also known as 13-cis-retinoic acid. However, it proved to be ineffective for that purpose, so was set aside. However, they found it proved to be the most effective at treating the ravages of severe nodular acne and cystic acne, and thus changed uses to treating acne. However, in the early days, they received numerous lawsuits against the drug. Throughout the 1980s, warning efforts escalated as the FDA and other regulatory agencies debated what to do. Eventually, doctors were issued informed consent forms to be signed by patients, and a series of increasingly stringent pregnancy prevention programs were put in place. Biology. Isotretinoin works by reducing grease, sebum, production in the skin by shrinking the sebaceous glands. This is why dry skin is the main side effect. Grease in the hair follicles causes overgrowth of Cutibacterium acnes bacteria. This leads to inflammation and acne spots. Isotretinoin removes acne by dropping grease production. Isotretinoin also stops the hair follicle cells from being so sticky. This means it stops hair follicles from getting clogged up by skin cells. Because cells are slightly less sticky, they are also prone to shearing with trauma. Many people will find their skin is more fragile on isotretinoin for this reason. This is also why waxing and threading must be avoided, as it could pull off the skin as well as hair. Accutane and tretinoin makes you photosensitive, as the combined effects of reduced oil and thinner skin make your skin much more susceptible to sun damage and burning. So sunscreen is a must. Benefits. The biggest use of Accutane is, of course, fighting off acne. This is because Accutane shrinks pores and reduces oil production. This leads to the added benefit of shrinking your nose and being a useful anti-aging drug. Negatives. Some negatives of Accutane is it's quite liver toxic. This is due to a combination of oxidative stress, its interference with lipid metabolism, and the strain on the liver's drug metabolizing system during its breakdown. Another disadvantage is it makes you photosensitive. This due to, as stated earlier, reduced oil and thinner skin. Dry lips and skin are also a common side effect. This due to, as stated earlier, lower oil levels. Topical versus oral. Why you should choose Accutane. Topical. Most people lost acne within 6 to 9 months. However, results weren't always permanent in a lot of cases. Studies show that it also reduces acne scar size and is more effective than Accutane. 79% of people's acne scars removed within tretinoin versus 64% with Accutane. Studies also show that tretinoin is a very good anti-aging tool, but effects are similar to Accutane. However, studies and anecdotes show that tret can cause severe peeling and redness in a lot of cases. Oral. Most people acne went permanently away after using Accutane after 4 to 6 months, even after stopping. Studies also show that it also reduces acne scar size as well. However, evidence suggests that topical is more effective against acne scars. Studies also show it's a powerful tool for anti-aging and collagen. It also has no peeling effects. All in all, isotretinoin mogs tretinoin. You shouldn't use tret for any other reason than for anti-aging. Other measures. If you're taking Accutane, you have to do a couple things first. 1. Always use sunscreen. Otherwise, you will burn and destroy your skin. Use SPF 50 PA+++. 2. Always moisturize and have Vaseline handy. This way you don't look very dry and you don't have a phyllo of dry lips and skin. 3. Use a liver protective substance whilst using isotret. This is to minimize the liver damage and make it negligible. I'd recommend milk thistle or NAC. Recommended dosage. This depends on many factors, such as what other drugs you are taking, the amount of period you're taking it for, how sensitive you are to acne. Generally, though, high doses are 40 to 50 milligrams, Average dose is 20 to 30 milligrams. A low dose is 10 to 20 milligrams and a microdose is 5 to 10 milligrams. Conclusion: Accutane is the most effective retinol mogging stuff like tretinoin to Gandhi. It also has the added effect of not always use sunscreen with Accutane. Always take it when you're on a cycle. It would work well in anti-aging stack at low doses, 5 to 10 milligrams. Please like and subscribe.